So here we're going to look at drugs for treating cardiovascular concerns. So we're going to be looking at, to complement our discussion on the cardiovascular system and the pathology portion of the course, we're now going to look at various drugs that can be used to treat some of the more common cardiovascular concerns that we have. So again, I want to encourage you, look at the tables throughout the chapters. Again, we're going to be looking at obviously all the various categories of the drugs. Using the tables in the text, make sure to review those. And again, my primary concern is that you're, for instance, in this chapter, you're aware of the different categories, and within those categories, how do those particular drugs work, be able to recognize some names of some of the common drugs within all the different categories, and also, again, obviously the negative effects or the side effects that the various drugs have. So looking at the pathologies we're dealing with, and again, we've discussed some of these things in depth in the pathology class, but we'll kind of, again, be reviewing some of the background on some of them here and kind of get an idea as to how the medications can work. So angina pectoris is basically going to be the chest pain that an individual experiences when there's some type of decrease in blood flow to the myocardium. So they're experiencing what we'd call myocardial ischemia. Okay, so they would start to then have, basically what's essentially happening is there's that imbalance between the oxygen that's able to get there and the demand for oxygen. So, the myocardium obviously needs a certain amount of oxygen, which obviously the blood flow gets it there. If that's reduced for one reason or another, they will start to experience that ischemia. And obviously, if that progresses further, they could end up with a myocardial necrosis, which then results in a myocardial infarction or a heart attack. So if you have so the first thing is, when you're looking, if you're in the situation where an individual is experiencing ischemic chest pain, again, take a good history and do a physical exam if possible. And we'll talk about what are some abnormal vital signs to look out for while you're treating the individual. Again, the angina is going to be basically caused by that myocardial ischemia. So basically the blood flow to the myocardium through the coronary arteries is basically getting inhibited. So the medication of choice to treat this is nitroglycerin. So this is going to be the first medication that we're going to be looking at. So again, this is one of the anti-ischemic drugs that will be utilized, and this is going to essentially reduce the cardiac workload in patients that have this. So what nitroglycerin is basically going to do is dilate the blood vessels, which is going to assist and it's also going to assist in reducing that the oxygen demand. So, and essentially in a case where someone's having an acute case, they're going to use a short-acting nitrate, which is going to be administered sublingually. And the thing you have to keep in mind is, when utilizing these drugs, they're dispensed in a glass vial. They don't have a very long shelf life once the bottle's open. So, I mean, obviously you're going to be using them in an acute situation. They should get relief within 5 minutes. And again, the nitroglycerin administration can be repeated every 5 minutes. But if their pain doesn't improve in 5 minutes, you should definitely make sure that 911 has been called before they take any additional. So if you do administer or assist a patient with nitroglycerin, if after 5 minutes pain doesn't improve, call 911. Make sure 911 has already been called if it hasn't been called already, and before you administer any more nitroglycerin. But they typically will get relief for this fairly fast. And again, the idea here is nitroglycerin is going to dilate the blood vessels. Therefore, it's going to help reduce that ischemia that's occurring, and the oxygen demand for the heart is going to get lowered as well. Now, obviously, in these situations, again, you want to make sure that you are aware of particular red flags and be ready to treat a person for a more serious condition, or if they are starting to possibly get into a myocardial infarction. So again, any type of abnormal vital signs Signs of hypoperfusion. So if they have confusion, they have ashen skin, diaphoresis, pulse ox is less than 95. So if you take a pulse ox, it's less than 95. That's potentially a more serious situation. Any type of asymmetric breath sounds or pulses, heart murmurs. Your textbook mentions pulsus paradoxus. Make sure to be aware of those particular red flags whenever you're dealing with somebody that is complaining of chest pain. Now, atherosclerosis and coronary artery disease. So, coronary artery disease secondary to atherosclerosis. So, atherosclerosis, as we've already discussed, is an increased lipid deposition in the blood vessels. And that's is a result of endothelial dysfunction. So you get endothelial dysfunction, less vasodilation in the blood vessels. That could potentially cause basically narrowing of the coronary arteries. So again, being aware of the pathology is very important. So it's kind of a combination of all of those things that eventually could lead into coronary artery disease and some of the negative secondary effects of that. So commonly what we look at with individuals with this elevated cholesterol and triglyceride levels are something. We talk about hyperlipidemia or dyslipidemia, so an elevation in the plasma cholesterol and triglycerides. Both of those could contribute to the development of atherosclerosis. And again, this is something that can be asymptomatic for many years. Until some of the actual symptoms start to develop. Some of the more serious symptoms and complications related to atherosclerosis and coronary artery disease. Obviously, we've already talked about angina. So again, if the blood flow to the myocardium starts to get reduced, that, again, that imbalance between the oxygen needs of the myocardium and the oxygen demand gets imbalanced, and you start to have that chest pain. Transient ischemic attacks can occur as well, or that, and again, also leading to cerebrovascular accident or stroke. So basically, if a plaque ruptures and occludes a major artery, whether that's in the heart or in one of the major blood vessels in the brain, that could cause again, either heart attack or stroke as a result of this of these abnormal deposits in the blood vessel walls, and obviously in the most severe cases, sudden death. So any of these potential more serious symptoms could lead to sudden death, whether that's again starting from a heart attack as a result of a myocardial infarction, leading all the way through blockages in other blood vessels throughout the body in the case of transient ischemic attacks and strokes. So in looking at drugs used for treating coronary artery disease, before I kind of get into the drugs, I just want to make note that, one of the things that, in addition to, pharmacologic interventions, you would also like to have lifestyle risk reduction things occur as well. So obviously we want to look at, again, before we get into any of the drugs, we want to look at lifestyle, dietary modifications. There's also revascularization techniques. As the textbook talks about, those are all things that could certainly assist in treating coronary artery disease. So, when we're talking about revascularization techniques, we're talking about interventions such as percutaneous coronary intervention or coronary artery bypass grafting, which are surgical techniques utilized to kind of manage this as well. In addition to that, or in the case of pharmacologic interventions, so antiplatelet agents could be used. Aspirin, and you see the dosages here for high-risk individuals. For kind of daily intervention, you hear people taking a lower dose aspirin or a baby aspirin, and there's the potential to reduce short and long-term mortality risk associated with this. Probably some of the most commonly utilized drugs that we look at are your anti-atherogenic drugs or your statins. So statin drugs inhibit the enzyme and blocks the pathway for cholesterol synthesis. The idea here is to lower LDL cholesterol, which is potentially one of the things that could predispose an individual to the plaque formation in coronary artery disease. So these are probably some of your more common drugs utilized. These are some of the most common prescriptions worldwide. So again, make sure to be able to particularly recognize these. You can, recognize the names of statins fairly easily. Atorvastatin is one of the more common ones, or Lipitor. So some things that you do have to really note with these is the drug-food interactions, particularly with grapefruit, because they inhibit the breakdown of statins, so that could make the statins basically stay in the blood for too long, can increase the negative side effects. And again, probably the most common thing that people complain about is issues regarding muscle pain, soreness, and weakness. So the statin-induced myopathy, rhabdomyolysis is also another thing that you have to be aware of, and that's the breakdown of muscle tissue and the leaking of myoglobin into the bloodstream, which could also strain the kidneys. So you do have to be aware of that. One of the diagnostic signs of that is elevated creatine kinase levels, which at that point somebody would have to then be treated for the rhabdomyolysis. So other drugs looking at that we're using for treating coronary artery disease. So anti-ischemic drugs. These are going to be some types of drugs that we've kind of already mentioned before. So we have nitrates and adrenergic blocking agents like low pressure. These will be prescription for individuals with unstable angina. Anticoagulants, heparin or warfarin, again, will also be another common prescription here when looking at an individual getting treated with these. So anti-ischemic drugs will be for patients who have been previously with chest pain, who have been previously prescribed medication. Some things to kind of note in looking at these particular drugs, particularly with the nitrates. The short-acting nitrates, you have to monitor the blood pressure. So you want to make sure the blood pressure remains over 100. It should definitely not, the systolic blood pressure remains over 100. It should not drop below 90 millimeters of mercury. Again, we're looking at the systolic blood pressure there. And again, usually the short-acting nitrates will act very fast, but you want to make sure that you're monitoring the blood pressure with that. Beta blockers are another thing that can be utilized. Propranolol will be something that can be utilized, and that blocks the sympathetic heart stimulation. It is going to be important though for athletes with drug testing in sports where beta blockers are banned, to make sure that they're aware of that. So if there's an athlete where they participate in a sport where beta blockers are banned, they are not going to be able to utilize those particular drugs. Angiotensin II receptor blockers are another class of drugs that can be utilized in this situation as well. So they can be utilized. We've talked about the mechanism of them already, but those can also be utilized in individuals with coronary artery disease. Acute coronary syndrome. So acute coronary syndrome is it's a group of conditions that develops from insufficient coronary blood flow to meet the demands of the myocardium. So again, this is kind of within that sort of constellation of issues related to coronary artery disease, but this is the acute situation. And so we look at, again, an acute obstruction of the coronary artery. So red flag review, so look at the types of chest pain that get discussed. So the red flag and the red flag section in your chapter on this talks about the different types of cardiac chest pain. So again, typically when you're looking at chest pain, particularly in younger individuals, if we're talking like, in a lot of work settings for athletic trainers, typically chest pain is going to be actually more structurally related, but obviously, you have to be aware in other, work work environments and situations where you have to be able to recognize that cardiac pain. So the red flag section talks about what they call classic cardiac chest pain, radiating chest pain, and exertionally related cardiac pain. So make sure you're aware of that. So the drugs and pre-hospital interventions related to acute coronary syndrome. So again, antiplatelet drugs. So, again, 81 milligrams of non-enteric coated aspirin can be administered. And that could be a very basic antiplatelet that can be utilized. Make sure to be aware of in administering supplemental oxygen. So if the pulse ox drops below 95, at least 2 liters per minute by nasal cannula for your supplemental oxygen. And again, some of the other types of drugs, which we already talked about, your anti-ischemic drugs. Again, your short-acting nitrates can be utilized for that, whether that's sublingually or through a spray. And your anticoagulants can be utilized in this situation as well. So drugs for managing hypertension. So, and again, we've talked about some hypertension drugs already, because obviously, again, they could be utilized with coronary artery disease as well. But here we're talking strictly about just the diagnosis of hypertension and hypertensive crises. So again, hypertension, sustained elevation of resting systolic blood pressure, diastolic blood pressure, or possibly both. That's, again, this is a pathology that we discussed in the pathology section of this class. So again, a lot of the drugs that we're going to be talking about here we have mentioned with coronary artery disease as well, but we're going to emphasize some specifics related to them. So diuretics, they're just going to promote diureses and increase urine production. So there's a couple different types of diuretics. There's your loop diuretics, which basically is going to decrease reabsorption of sodium by the kidneys. These are some of the common side effects. So, loop diuretics tend to be very potent. These are probably not as well if an active individual, it's a very active individual, they may not tolerate these quite as well. So again, lightheadedness withstanding, tinnitus, they could be photosensitive with these. Again, you could have serious side effects when you start to have decreases, particularly in magnesium, calcium, potassium, and sodium, as those levels could potentially drop very low. Your thiazides, which are another type of diuretic, they're not quite as potent, but they could be potentially tolerated a little bit better. Hydrochlorothiazide, which is one of the more widely prescribed hypertension drugs. Again, you kind of see similar side effects with this, particularly, again, the things like the dizziness, the abnormal calcium levels as well. So again, these are very widely prescribed. So the thiazides and the thiazide-like diuretics, which would be like the hydrochlorothiazide, those drugs are going to act at the level of the kidneys. So there's going to be some things to be mindful of when you're looking at those drugs. So looking here, so this figure here comes right out of your book, and this is basically showing you. So what you're essentially looking at is the kind of the nephron loop of the kidney. So this is kind of like the functional unit of the kidney. So kind of within the kidneys, you have a bunch of these sort of functional units throughout, and this is kind of how the kidney essentially works. And what basically this is showing you, if you kind of go through this, you're going to be looking at the different areas where all of the hypertension drugs are basically operate. So it's showing you where osmotic diuretics, loop diuretics, and the thiazide diuretics work, and then the potassium sparing diuretics. So you could kind of see throughout the functional unit of the kidney here where all of those different areas work. And again, this is just to effectively regulate the fluid in the body, which can help in kind of lowering your blood pressure. So some other drugs utilized for managing hypertension. So again, the ones that we've just talked about, so we saw how they work at the level of the kidneys and kind of regulating the fluid in the area. So again, some of the things you think about with the particularly the side effects, again, sometimes it's a little hard to remember all the different side effects. If you kind of understand the way the drug works, it allows the side effects to make a little bit more sense. So those drugs work at the, when we're talking about all the different diuretics, they work at the nephron loop at the kidneys, and we talked about where they all work. So beta blockers, which we've kind of already talked about, so then these drugs work, again, like a lot of the other drugs we talked about for both hypertension and coronary artery disease. These will work directly at the heart. So there's beta receptors on the heart muscle, and there's beta receptors, throughout the cardiovascular system, throughout the smooth muscle, and in different parts of the body. They're responsible for reducing heart rate and cardiac contractility. So what you're actually doing here is now, in the case of somebody with hypertension, you're actually just basically reducing the increased pressure directly coming from the heart. So it's a real simple way to look at it. Now, what you could be dealing with here are just some issues. So obviously now, if you're kind of, you're lowering the heart rate, you're reducing the contractility of the heart. So now some of the kind of like negative side effects that you're going to see are going to kind of come from that. So there's the potential for decreased myocardial oxygen, and you really need to make sure that you're monitoring the pulse and blood pressure of individuals who utilize this. So they are widely used to treat hypertension, but a lot of times for a lot of patients, they're not going to be the first choice used. We talked about propranolol earlier, and propranolol specifically is used to block sympathetic stimulation of the heart, and that's going to reduce some of that. However, obviously there's the potential to have a significant increase in bradycardia, and hypertension, with particularly for active individuals, can sometimes be very problematic. And your textbook actually highlights the case of a basketball player by the name of Hank Gathers, who was diagnosed with a cardiac condition, and one of the things he was prescribed propranolol, and he actually felt like he actually stopped taking it and had a sudden cardiac death actually while on the court. And part of that was because he basically stopped taking the medication because he felt like it was slowing him down. So it's interesting. So now we talked about how beta blockers are sometimes banned by certain sports. So you're thinking, well, then why would it be banned if it actually inhibits performance? In some sports, it doesn't inhibit performance. In sports where, something like rifle, where someone has to be able to, really maintain a steady hand and focus, it actually slowing the heart rate could be beneficial. So it's not a detriment in all sports. So in those sports, it's particularly banned because it could actually be performance enhancing. However, in a lot of other sports, particularly like something like basketball or most other team sports, where there's much more cardiac, where the cardiovascular system obviously has to work very differently. There could be issues with that. So other drugs here, angiotensin converting enzyme inhibitors, and again, they will end. One way to recognize them, as we say, we always try to find ways to recognize certain classes of drugs. They typically end in the suffix pril, P-R-I-L. Again, these are going to be used to treat hypertension, chronic kidney disease, congestive heart failure. So again, what you're basically going to allow here is you're going to get relaxation of the blood vessels and a decrease in blood volume. Lisinopril is one of the more popular options here when you're looking at particular drugs that get utilized. Usually individuals who are using this particular type of drug usually require lifelong treatment with these particular drugs. So again, this group of drugs is going to cause, again, as I had already mentioned, relaxation of the blood vessels as well as a decrease in blood volume, and that's going to lead to lower blood pressures and a decreased oxygen demand from the heart. And the way they're basically going to do this is that they're going to inhibit the angiotensin converting enzyme. which in the kidneys, the renin-angiotensin system is responsible for kind of monitoring the tone in the blood vessels. So again, all basically ACE inhibitors are going to block that conversion. So they're all going to have very similar adverse effect profiles when you're looking at all of them. Angiotensin 2 receptor blockers, they're for efficiencies, they compare very favorable to ACE inhibitors. What they're going to do is block the hormone from the receptor. So, review the contraindications for both ACE inhibitors and angiotensin 2 receptor blockers, because they're both very similar in how they work individually. And then the last type that we talk about here in the management of hypertension, so calcium channel blockers. Again, we're going to discuss those a little bit further with arrhythmias, but they're also utilized in treating hypertension. So turning now to cardiac arrhythmias. So again, based on what we've kind of looked at with the pathology section, we kind of all should understand, again, how the normal coordinated beating of the heart occurs with the electrical impulses. However, as was discussed in that class, there are various types of what we'd call arrhythmias, or also known as dysrhythmias, where there's various types of cardiac conduction disorders whereby there's essentially an issue with that little electrical discharge and kind of how the heart regulates its beat. So again, it's a group of conditions. We talked about some specific ones and ways to recognize them in the pathology portion of the course. Again, anytime here we're looking at an abnormality in a conduction of the electrical impulse, again, the concern here is the potential for a more serious cardiac-related issue because of the arrhythmia. So again, this can result in stroke, heart failure, sudden cardiac arrest. So this is why it's really important to find a medication that could kind of help in kind of treating the arrhythmia. It's important to note that while the goal of treating these is of an anti-arrhythmic drug, there's the potential for them to be pro-arrhythmic as well. So you want to make sure that, again, an individual will be closely monitored when they start a particular drug to make sure that obviously it's not going to make the individual worse off. So again, what you're going to look at all of these medications, their goal is to suppress the abnormal rhythm. Again, as you go through this, and kind of take your time and even again connecting some information from the textbook, be aware of again the kind of the mechanism by which they work, and then again some common names of medications to be able to recognize them, and again some of the typical adverse effects associated with them. So sodium channel blockers block the transmission of the electrical signals, lengthen cell recovery periods, and they basically make the cardiac cell less excitable. They can potentially increase the risk of sudden cardiac arrest in people who already have heart disease. So again, that could be a reason for potentially for them not to be selected for a particular individual. So here you have procainamide, which is a common sodium channel blocker. Again, recognize some common names associated with these. Calcium channel blockers tend to have less significant side effects. Again, these are also used in the treatment of hypertension. They will directly slow a rapid heart rate. So these are again very these are tolerated very well. So even a lot of times in active individuals who have hypertension, these will get utilized as well. Verapamil is a very common calcium channel blocker. So again, these are going to be used typically to control arrhythmias in the upper chamber of the heart. So sometimes, however, again, when we're looking at people with arrhythmia, sometimes certain drugs can make things worse. These could sometimes also trigger a ventricular fibrillation, which again we'd want to monitor for. Potassium channel blockers, again, their goal is to inhibit adrenergic stimulation. And aminodarone is a very common potassium channel blocker. Cardiac glycosides, such as digoxin, They're frequently used to treat a fast heart rate, atrial fibrillation, atrial flutter, and they're also used in individuals who have heart failure. So digoxin in particular tends to shorten atrial and ventricular refractory periods. So that's going to be how they kind of operate and how they're utilized at in the case of cardiac arrhythmias. Beta blockers again. So beta blockers can also be used. And again, they could be used to, again, decrease heart rate. We had talked about them with individuals who have, coronary artery. So again, here you're seeing another drug, multiple uses. So coronary artery disease, hypertension, and now cardiac arrhythmias. So these could be utilized for this as well. Lassitude, which, an adverse effect from that is going to be lack of energy and weakness, which is part of the reason why with very active individuals, these drugs can be difficult to utilize. And another type of drug that will be used, now this doesn't necessarily directly reduce or do anything to the heart rate. However, anticoagulants will also be utilized in individuals with arrhythmias, and that's just to reduce the risk of complications from the arrhythmia. So the anticoagulant is not going to directly impact the arrhythmia per se, but what it could do is reduce clotting risk. So one of the risks with certain arrhythmias is the potential to produce blood clots. So again, this is going to be utilized to prevent. So again, it's important to understand how sometimes drugs are utilized with certain pathologies. So in the case here, the anticoagulant is directly utilized to prevent the potential for blood clotting to occur in individuals that have cardiac arrhythmias. Thromboembolism. So thromboembolism is the formation of a clot inside the vessel. So when we're looking at, and again, there's a lot of different terminologies here. So effectively, you're looking at abnormal blood clotting. So again, some of the terms here are going to be important. So whenever there's an imbalance in favor of coagulation, that results in the actual, what we call a thrombosis. So the thrombosis is the actual formation of the clot. When the clot travels throughout the body, that's known as an embolus. So if you hear of a pulmonary embolism, that's essentially a clot that was dislodged and it moved into the lungs. So again, they then use the term together, thromboembolism. That's the formation of the clot inside the blood vessel in general, and that's when then you're going to have some sort of obstruction. So the medications that we look at, again, much like what we've talked about before, are going to come in different classes. So again, you want to make sure you understand how all the different classes of medications work, recognize some common names of drugs within those classes, and then again, obviously, adverse effects. So particularly when we look at venous thromboembolisms, which are very common, or we talked about you've probably talked about in other classes or heard of the term deep venous thromboembolism. So these are going to be some medications utilized in those circumstances. So anticoagulants, which we've already talked about, and we talked about them in treating some of the other cardiac issues. Again, their job is to just slow the clotting process, prevent clots from forming. Again, warfarin is a very common anticoagulant utilized, whereas antiplatelets prevent platelets from clumping together. So, we're going to show on the next slide, and there's an illustration in your book in kind of how antithrombotic drugs work throughout the cardiovascular system. Plavix is an antiplatelet drug, and they're used many times in the prevention of heart attack and stroke. Fibrinolytics, or what we call clot busters, those are particular drugs used in the treatment of ischemic stroke. Alteplase is a very common fibrinolytic use. Goes by the brand name Activase. Again, those are going to be those will be administered in the emergency rooms if someone's suspected of suffering stroke. Obviously, the biggest issue with all of these drugs would be the risk of bleeding. So if you're going to slow clotting time, that's going to increase the chance of increased bleeding when you're talking about individuals who are getting treated for these conditions, who are actively taking them. any type of wound will possibly have an increased risk of severe bleeding. So that's why it's very important if you have patients who are taking these medications, again, you have to understand that, any type of minor injury can cause significant bleeding. So again, make sure that you are aware of that. And again, considering having a backup supply for particularly for patients who are going to be traveling. So again, you need to be aware of the risk of individuals that have these, and if an individual does suffer a laceration or a contusion, it could possibly exacerbate certain conditions. So here's the figure from the text. Again, this is just kind of showing the clotting process, and then so antithrombolytic drugs are going to be, again, either typically your anticoagulants, antiplatelets, fibrinolytics uh, are going to be utilized again to kind of sort of break this up. So this is just basically showing you, if you look at this picture, so you see the platelets here, the blood clotting proteins form a network, and then this is basically just showing like the clot actually forming. So we know the platelets are responsible for blood clotting. You have your proteins in here, and again, all of these, again, the drugs also basically work as, they're all like blood thinners, as they would be kind of referred to many times by people, but they just all work from a different mechanism. And then again, it's going to be kind of based upon the individual as to what they'll be, based on at the discretion of the prescriber, which particular ones will be utilized. Again, make sure you can recognize names, recognize mechanisms of action. Again, you're not going to be in a situation where you're going to have to decide what type of drug they have to take, but you need to be aware of all of them. So looking to summarize, so again, we have our summary, and then we have our learning objectives. So all of this could kind of help you stay organized in your studying. So again, be familiar with the nature of the cardiac medications. Obviously, it's important too to understand the pathology. So we've talked, we spend a whole chapter talking about cardiac pathologies. Now you can make the connection, connect the two, whatever we're talking in this particular class about, a section on pathology and then the medications associated with them, make those connections between the two. Again, common cardiac orientated medications, particularly the very common ones. We know the issues with cholesterol and hypertension. Understand the role of medication for treating those venous thromboembolisms is very important. Again, that is something that could, that in particular could come up in when you're talking about treating and dealing with the active population. So be aware of that. And again, be aware of any type of side effects. So again, the easiest way to look at the side effects in many instances, again, if you're aware as to how the medications work, instead of trying to memorize. Now again, there's going to be side effects that maybe don't make as much sense, and those would be the ones more to memorize. But if you kind of have an idea, then you could kind of recognize side effects if you're aware as to how they work. Because remember, when you take a medication, so any of these medications that we're talking about within the cardiovascular system, they're somehow basically taking a way your body's working, and it manipulates it. Obviously, it's pathological, but it could possibly kind of go to where it almost works too much. And then if you think about how it works, like in the case of, again, let's look at a beta blocker. So a beta blocker is going to slow the heart rate. It's going to weaken it's almost going to kind of weaken the contractility of the heart. If you just think about from the standpoint of an athlete where there has to be vigorous cardiovascular activity, you could understand how a medication like that could potentially not be maybe the best choice for that particular individual. So just be aware of those, and again, make sure to take some time in understanding them. And these would be your learning objectives for the particular chapter that we just reviewed.